How's everyone doing out there? We are now live. Brought to you in part by Invisibles No More. Unfortunately, we were not able to get Keith into the studio today, and I don't have the illustrious hair that he does, but we do have him virtual. So, Keith, do you hear me? Are you there, good
I
buddy?
I hear you, brother.
All
Can you
right.
hear me?
I can hear you loud and clear. Let me go ahead and pull you up. All right. You're looking good.
Well, good, because on my end, on the Zoom thing, I am frozen. I am not moving. So as long as you tell me that you can see me and that I'm moving,
You know what? You look
well,
frozen on
well,
my end as well. Oh, there you go. Now you're
here
moving.
we go.
All right. Cool, cool, cool. Well, let
All
me go
right.
ahead and get you a full
Well,
screen here. Give me one sec. Kabow. Welcome all in the chat. And Keith, my
I
good
think we're
friend,
live,
we are
and I think
invisible no more. And you, sir, are now live. Floor's
am I
yours.
vis am I visible now? Can people see me or can they hear me? Let me know in the comments if you can see or hear me. I would appreciate that. Little different tonight. Little different tonight. It has been a week in the life of this invisible. It's been a little more than a bad week. Last weekend wasn't great. Then we ended up losing one of our pets yesterday, and kind of in a very quick, rapid thing. We'd had Rascal for, I don't know, Valerie will clear it up, 10 years or so. Um, Definitely unexpected and definitely a hard hit. So if you have messaged me in the last 24 hours and I did not respond, that is why. And then I'm away to the studio tonight to do the live. I got about 15 miles away from the house, and it's not a good thing when all of a sudden out of nowhere, half dozen or so check engine lights come up on your dashboard and you barely are able to make it back to the house. So
Yeah, glad you were able to make it back.
I'm telling you, I tell y'all, you need to say kudos to Kevin for pulling this one off tonight. I'm not sure how many buttons or how many rolls of duct tape and baling wire he's used to pull this one off, but it is.
There's
I'm
always
thinking,
something somehow,
I hope in his expense account covers all of that. But we're here. We are here, and that is the thing. Because if you've seen us on TikTok or other social media, you know that Invisible is a community, and a lot of us look forward to the lives for the community, and just kind of hang out, be seen, be heard, know that we're loved, and know that we're not alone. A couple of things for tonight. We do have a topic for tonight, and I'll get into that very shortly. But first, I want to say I am going to try to do my best. In fact, I'm going to take my glasses off so I can pull it off. So sorry about that. I'm going to do my best to keep an eye on the comments tonight. So if there's an issue that you're struggling with, or you need to just verbally vomit, we can pause this topic tonight. We can pause this topic of diagnosis tonight. And if there's something you need to get out or question you have, whether it's about the network, whether it's about Invisible, whether it's about a procedure your doc wants to do, or a certain medication or something, throw it out there, please. And I will do my very best to keep an eye. Just know that when I'm seeing your comments, that's about 8 to 10 seconds after you type it. Unlike on other platforms like TikTok, where they're instant, that's not instant here. There's a little bit of a lag. So if you have something, keep typing it. I will see it eventually. Just give me some time, because it's going to take a few moments for it to make it to where I can see the comment. Hope that's clear. Hope it's clearer than the mud that it sounds like in my head. So I think I mentioned last week, Doc Leak put together this package covering the 12 weeks, the first 12 weeks of the Eclipse Pain and Recovery Network's programming. And once we're all said and done, hopefully he'll let me release it to show you all the details that he's gone through. And every week starts with something that's called a belief violated. It's a belief that some doctors have, some care teams have, some of our family members, our partners, our spouses have, that they feel is true. And then what we do is we try to violate that belief. And how do we violate it? Well, we bring in lived experience. We bring in facts that can violate, challenge that belief. Like, for example, this week's belief that's being violated: a diagnosis explains everything that's wrong. A diagnosis explains what's wrong. We're going to violate that, and we're going to introduce this piece of truth that labels, aka diagnosis, often in curiosity. You might have heard Dr. Leake talk about anchor diagnosis or anchor or medical anchors, where sometimes we get a diagnosis and it causes some care teams to stop being curious about what could be causing the symptoms, and they just go to treat symptoms. And we'll get into that a little bit further. So tonight's belief that we're violating is that a diagnosis explains everything that's wrong. Like on Monday, Dr. Leake was pretty explicit when he talked about when diagnosis is stop clinical thinking, not just critical thinking, but clinical thinking. On Tuesday, Jose talked about why degenerative is not a prognosis. And one of the key takeaways from Jose's live on Tuesday was once you hit about 25, congratulations. Chances are you have degenerative disc disease.
Congratulations. That is too funny though, isn't it?
Well, it's really, I mean, it's like a reward, for all the stuff, the crazy stuff you did as a kid.
Yeah.
It's just that for some people, it causes issues. That's me. For some people, they'll never even know they have it. They'll go to their grave not knowing they had degenerative disc disease. Then last night, Katie hit it out of the park again. If you're not catching Katie and Nourish and Thrive on Wednesdays, I'm sorry. All of her lives are up. You can watch them on video. Man, she explains how our diets can seriously mess us up and how small changes in them or small attitude changes really can make a difference. And she focused on how metabolic labels can obscure root causes at times. So tonight, what was given me is the following: living inside a label that explains nothing. Living with a diagnosis that explains nothing. Man, when I first read that, and Kevin's a witness, and even Dr. Leake, I'm like, what the heck am I supposed to do with that? Because it wasn't clicking last week in my brain because it'd been a really long day and I was hurting really bad and I couldn't think about it. And I started kind of digging into it. And you know what? Living with a diagnosis can often explain nothing. Think about that. Because I think it's happened to more of us than what we want to admit, to be honest with you. I think I've mentioned in the past that I deal with undiagnosed ADHD, that I'm on the spectrum somewhere. So part of what the clues my therapist into that is I have this thing for definitions. And one definition, one word really piqued my interest this week. And I've been doing a lot of reading up on it. On Monday, Dr. Leake said something along the lines of the idea that pain is syndromal. Pain is inherently syndromal, meaning that's medical language for what all of us patients have known for a long time, that our diagnosis labels groups of our suffering, but it doesn't explain it. Fibromyalgia, POTS even, irritable bowel syndrome. It takes our symptoms and gives it a diagnostic name, or it doesn't always go to the true root of what's causing our issues. Sometimes that's good and sometimes that's bad. Sometimes that does stop doctors from searching further when we feel there's something more going on. Other times, that's really all we can do is label those symptoms. And we'll get into later how it's important as us as a patient, we have to, right off the bat, instead of just automatically accepting it, is there other things we can do, other tests we can try, other treatments or other plans we can try? But we'll get into that here shortly. See, a diagnosis can start something that's called a relief and abandonment cycle. We finally get diagnosed and we can realize at times that nothing changes. We know we fight for years to be believed, to get a name for what's going on, to be able to go home with a piece of paper from our doctor and say, look, honey, I actually have something. I told you I did. We fought for that diagnosis. We went to all the damn appointments. We did all the research. We did all the tests. We defended our symptoms, but yet we faced dismissal, not just from in the medical field, but from the people we count on to be there for us, right? Some of us have left appointments wondering if we were really losing our mind. Is my heart rate really going like this? Is it really spiking like this? Everybody takes a cold shower at 3 o'clock in the morning to regulate their body, right? Right? I'm not the only one, am I? part of what I'm trying to do in all these presentations on Thursdays and Invisible is to let people know they're seen, they're heard, they're loved, and they're not alone. And I give examples like this, not to bring up bad memories or to trigger people, but to let you know that if you've experienced some of these, you're not alone. Because see, you fought for this diagnosis because you needed a label mentally, right? We needed to know we weren't crazy. We needed that label to show our partner, hey, something really is going wrong with me. Because a diagnosis is tangible. I'll give you a personal example for me. I had no idea what was going on with this deep bone ache in my thighs. Deep ache. I wouldn't wish this on anybody, even my ex-wife. I'd wish kidney stones on her, but not this pain because it's that horrendous. It's that horrendous. She's the only person on the planet I wish kidney stones to. But anyway, it's a whole other trauma topic we can get into sometime if you want. But for months, I laid awake at 2 or 3 o'clock in the morning because I couldn't sleep because the pain was so intense. And I didn't know what the hell was going on. Finally, I got a label. And that label meant more to me than all the gold in the world because I could lay there at 2 or 3 o'clock in the morning with that pain, but I had something to yell at. I could say this freaking neuropathy. I wish I could stop it. It gave me that little bit of peace. I don't know. Maybe I'm an oddball with that, but I needed that name so I could yell at it, so I could vent some anger because it was tangible. It was something I could prove. But one of the scary things is, when we don't have that diagnosis, a lot of us, myself included, start wondering, is it really just me? We start doubting ourselves and we start doubting our experiences. And that's one thing that I love about Invisible is we can come together as a community and share those lived experiences, and somebody out there gets it, right? Somebody may not lay awake at 3 o'clock in the morning screaming the word neuropathy, F you, but somebody could be laying in bed at 3 o'clock in the morning going, why is my heart beating like it is out of my chest? This isn't normal. A diagnosis almost makes it feel like it's real, which is sad. I mean, it does give us this relief that we can tell everybody and tell ourselves, see, I'm not making this stuff up. There's relief there. You're not crazy. You're not being dramatic. You're not imagining everything. But once the dust settles, sometimes, quite often, you realize that nothing's really changing. There's no new treatment options. There's no path forward. It's just a label. There's no roadmap. How are we going to get better? Oftentimes, if we have even a good care team, I could see falling into the trap of the losing a sense of urgency. And, this is one thing that even some of the best advocates I know and a lot of influencers won't even bring this subject up, that this cycle happens, that we get the relief and then it immediately goes to nothing's changing. And we need to acknowledge that happens, right? It's like you're left standing in the same body with the same symptoms, but now we have paperwork, right? It's official. I'm hurting. Look. And again, I'm not bringing up these things to bring up bad stories, y'all. I'm bringing them up because I want people out there to know they're not alone in experiencing this crazy stuff. Because I know I have. When I was researching this, and when Jennifer, again, producer Jennifer, if you're not following her on TikTok or on Instagram or on Facebook, you need to. Jennifer is a wealth of information. I was researching, she was researching, and I'm going through all this stuff and I'm checking all these things off because I've lived it. And I feel if I've lived it, somebody else has. Lugnut said, I can't count the times I would take 20 for Advil in a day just to work and tell myself, you're just getting old.
Sounds like me with Motrin and ibuprofen.
Yeah. I was a big fan of NSAIDs. Everybody knows I'm still a big fan of lidocaine and capsaicin now. Amy says sometimes a sadness comes with diagnosis because you have no path forward. Unfortunately, in some cases, that's true. But also sometimes our diagnosis, unfortunately, becomes a conversation ender instead of a conversation starter. it becomes, you have fibro, congratulations. Instead of, okay, well, everything's pointing toward, all your symptoms point towards fibro, but let's dig a little bit deeper. And for a lot of us, especially if we're changing pain doctors, they're going to want to run the same test that somebody else has run. And that gets frustrating, right? I've already done this test. How many times do I have to do an EMG? They hurt. I would say this, an example, personal example that worked out for me. I went to the ER for this pain in my thighs. They did scans and they sent me home with one pain pill. I went back maybe a week later with the exact same pain, only worse. And they did another scan, the exact same scan, but they found that I do have pinched nerves around L3. I didn't have a name for it yet, but I had a possible reason. So when they have us do these tests over and over again, get mad, get frustrated. That's fine. I would be too. I was frustrated that night in the ER when they said they're going to scan again. But maybe having a different set of eyes on a test might make a difference. Just saying. You see, a diagnosis can validate the suffering, but it doesn't automatically move us forward. And that's when this relief of the diagnosis, like Amy was just saying, becomes kind of hollow. Some docs and some care teams hear fibromyalgia or chronic fatigue syndrome and they stop investigating. Or this one really hit hard for me because I heard it so many times from different doctors, whether they're primary care or they were specialists. That's just part of your condition. Anytime I would bring them something new, especially my previous pain management doctor, that's just what happens. That's just normal. Expect it, instead of trying to figure out, well, maybe this new thing isn't normal. The diagnosis for that previous pain doctor became the absolute end of any kind of investigation. So just don't give up, because sometimes if there's diagnosis and the urgency to keep digging and figuring crap out just starts to fade away, because some care teams will just take that diagnosis or your symptoms and that's it. That same previous pain doctor, he's the one that he got so mad at me for begging for help with my pain. He was so furious with me. I'm surprised he didn't fire me. He opened the door to walk out of the exam room and he paused. He turned around and goes, "Mr. Johnson, I'm changing your diagnosis. Official today. You now have fibromyalgia because it's the policy in my office. We don't give opioids to fibromyalgia patients." And then he slammed the door. Tell me there wasn't any urgency in him to find out what was going on.
None.
Talk about feeling lost in a new way, right, Kevin?
Now, the crazy thing, can men actually get fibromyalgia? As
I don't know why not.
I've only heard it, coming from the standpoint of women. I literally thought that was a situation of chronic pain that they faced.
I don't know, Doc, if you're here, type in an answer, or is Evelyn around? Evelyn knows everything. So I would imagine. Yeah, when he said that, there was no more investigation. But if you guys have heard that story, you know what his goal was. More dangerously, I think, is your diagnosis can reshape your identity. Suddenly you become the disease and not the person. And we've talked about this how many times on Invisible? I wish Amy was here right now. It says fibro can affect both. That we beg people not to let our diagnosis become who we are. And that's so tough, right? Because it does play a part in so much of what we are trying to do and trying to get accomplished. Some people start introducing themselves as our illness. Hey, I'm a fibro patient, or I'm a chronic pain sufferer. I'm Keith. How are you? Instead of, hey, I'm Keith, I'm a truck driver. Yeah, I deal with this chronic pain. So if you see me bending funny, that's probably why. We allow it to come before who we are. And that's easy to do, and it's understandable to do. I've done it. I've lived it. I've done it probably in the last week. But it's dangerous. In my opinion, it's one reason why we need to have the conversations with our doctors so they know us, because I don't want my doctor seeing, when he walks up to the exam room, looks at his chart, I don't want him to open that door thinking, okay, another person with a bad back. I want him to know me well enough to when he sees my name, he's opening the door, and in his head he's going, "Holy crap, this is Keith. What the hell is he going to talk about today?" And I think that plays right into when we let our diagnoses reshape who we are, you know. So, and again, if there's something that you need to get out of off your chest tonight, folks, please put it in the comments. I will do my best to catch it. I haven't seen anything yet, but if you got to get something out, you need to vent. I know a lot of people have messaged me in the last week, and I've had horrendous appointments. If you need to talk about that, please go ahead and throw it in. We can come back to this. All right. Another thing, when we let this diagnosis reshape who we are, our whole life gets filtered through that diagnosis. I'm not saying we don't beforehand alter some of the things that we may do, but I find myself at times allowing it to become an excuse to not do things. And when I do that, I feel like I'm becoming my diagnosis instead of being who I am. Am I the only one that does this? I hope I am, because I don't want anybody else to live like that. And another point, when we allow our diagnosis to define who we are, our friends and family start seeing us as our condition instead of you. The illness moves from something that you, along with your doctor or your care team, are managing, to something that defines you. Be you, please. You are a triangle. Don't let anybody put you in a round circle, right? Nobody is you. I promise you. And I think that in some cases, that same thing that we all hoped and prayed for, the diagnosis, can start to define the limits of our care. It can shape, in some cases, what the doctor is willing to do. I love Kimberly. Thank you. Kimberly's screaming, "I am not my diagnosis." I love you for that. It can shape what doctors are willing to try, right? It can determine what symptoms are taken seriously. Again, that's just part of what you have. And then they walk off. So instead of opening doors to treatment and understanding them, it can close doors. Remember, you fought like hell to get this diagnosis. You've lived through so many tests and so many appointments and so many dismissals and not being believed for so long. Take the diagnosis for what it is. Take it for ways to help yourself get better care. And if there is no cause for all of your symptoms, ask and work with your doctors to find out ways to better manage them, to get some kind of relief. Because at the very minimum, manage those symptoms the best we can, right? So we can focus on that quality of life. And honestly, Kevin, you were talking about earlier, is fibro just a ladies thing? No, obviously we were just informed. No, men get it too.
Yeah, I've only seen seemingly commercials that are that way, though.
But here's the thing. Ladies, and we've proven it when we did the Bias Project, right? How y'all get horrendous care compared to men. In emergency rooms, it's so stacked against y'all. And so when you get these diagnoses, I can understand the relief, but please don't always take that initial diagnosis as the answer. And please don't take it initially as a reason to stop looking. So hang on just a second. Let me catch up. Debbie said, absolutely no support really sucks. It does. Kimberly said, it took lots of therapy to see myself again. Thank you for being willing to give therapy a shot. Leslie said, changing meds, extremely nervous. I've researched it and reached out for support. Any suggestions? Are you comfortable with what the side effects of the meds are? That's where I would start. That's where I would really start. And then talk with your care team about what those side effects may be. And then if what you're on is kind of helping, if these new meds don't work, can you establish a contract with your care team to put you back on something that was giving you relief before you switch to the new meds. I mean, if I knew what I was talking about, those were the things I would start with, Leslie. Eclipse, I'm guessing this would be Evelyn. Remind your physician how your diagnosis affecting your function keeps the plan goal oriented. That's a great tip. Hi, all. Pain is my passion. I'm actually a former NFL player who got fibro. There you go, Kevin. You just met someone.
I was just reading that. Nice to have you. Welcome to the group.
Welcome to the group. Why don't you email me? It's Keith, Keitch. Did I say CH? God, you can tell I'm out of it tonight. KEITHCPP@gmail.com. Keith, CPP. Carl Payne @gmail.com. Love to talk to you. Get more of the story of a guy that has fibro, at least, at the very minimum. Lugnut said, don't forget when you get a diagnosis and the why defines the treatment you won't get the rest of your life. I'm a little lost on that one, Mark. Can you explain a little bit more? Please. But back to what I was saying, ladies, you guys face it worse than we do because the bias in healthcare is definitely alive and well, unfortunately, no matter how hard. I couldn't imagine because, like we talked in the Bias Project, do you wear makeup to the ER or do you go as you are in your comfy pajamas and slippers? If you wear too much makeup, doctors are going to see you as, oh, she feels great if she's able to take care of herself like this. Or if you go in completely looking shambles and your PJs and your slides on, they look at you as a med seeker. There is no way, right? And that's part of that bias, you know? And when we allow our diagnosis to define who we are, what happens is the diagnosis can begin shaping the decisions we make and the risks we don't take. You lose who you are and start living as the diagnosis. New symptoms, they fit the conditioning. Worsening pain, that's part of it. Something doesn't quite add up, and I think we might be missing something maybe. Well, fibro is still your diagnosis. It all fits, you know? And on Monday's episode, Dr. Leek went over something called medical anchoring, and I mentioned it at the very beginning. And I think, unfortunately, in my brain, it goes back to the same thing that ACE scores can be like, where we are just naturally honest people and we give all this information out, like with the ACE score, and with some unscrupulous care teams, that comes back to bite us in the ass in the end, where they hit a roadblock, don't know anything else to do, and then they blame it on something that happened as a trauma event back then, and tell you to go to therapy. There's nothing they can do for your pain. It's the same thing with our quote diagnoses, especially if you're switching care teams. Is it best to walk in and say, well, my last doc says I have fibro and this is what we've been doing, and you just keep going? Or do you present it more in a way of, in the past, there's been discussions, I may have fibro? Goes back to those, we don't want to say yes and no questions, right? Or ask yes or no questions. Because if we say my previous care team says I have fibro, we've been treating the symptoms with this, I would see a doctor being more wanting to go more along the lines with agreeing with the previous doctor. Or if we present it in a way, in the past, they've mentioned that I may be dealing with fibromyalgia, may be dealing with it, where that to me is more open-ended to help the new care team or a different doctor be more inquisitive instead of just taking a previous diagnosis and running with it. Everything gets anchored around that diagnosis. If we present it, this is what I'm doing, this is my current treatment. I think it's harder to say, this is what they've said I have, this is how we're treating it. Do you think I have it? I think it's harder to get doctors interested in investigating instead of saying, in the past, they've mentioned I might have, you know. Kimberly said, my fibro was 2 rare conditions, 10 years of damage from delay of the diagnosis. 10 years of, The delay of diagnosis caused so much damage. Dr. Leake put a video out early this week that it can take up to 5 years in pain management to get a diagnosis. So Amy said it's hard because he said the last doc said this, they may stop searching and just agree with the previous doctor's diagnosis, right? And it could be that you have fibro. Maybe that guy did everything he moved heaven and earth, and that's what he came up with. But if you feel something else may be going on, how do we present ourselves? How do we present where we are today to get them inquisitive enough to follow us, to allow us to try different treatments, or allow us to try more tests, or allow us to think outside the box? I would present it more. They said a maybe, especially if I was curious that it could be something else, And he said, "You're right. The investigation stops, and when it stops, there's no clear path forward. Your plan may never change, right? And if that plan doesn't change over time, that plan may not be working as well as it should." It's like a bias that providers can get. And bias shows up in every field. It's just that in the medical field, the consequences of a bias are personal because they impact you. Well, they impact you. They impact your family, your spouse, your husband, your partner, your kids, your pets, right? If that investigation stops. Now, again, you may end up with a fibro diagnosis because that's the only thing that really makes sense, because nothing's pointing to anything else in your symptoms. The same thing with POTS, right? But when do we make the decision to stop investigating and stop trying to push forward? I think everybody fights that. Because see, once that label is in your chart, it can shape how every future complaint is understood. That's just part of having fibro. Running to the bathroom, that's just part of having irritable bowel syndromes. Well, maybe there's something else,
So Keith, here's a quick question for you.
Yeah.
So when do you actually start revealing the truth?
I'm not saying now, to me, saying in the past, they've mentioned that I may have. That's not, to me, it's not an outright lie.
Okay.
I don't think so, because in the past, my doctor said everything points towards fibro.
Yeah. It sounds sometimes like, especially for maybe a first visit, boy, you really got to guard yourself.
Welcome to the world of being an invisible patient.
Right.
And that's kind of one of the goals. I got flamed by a person who was calling me an advocate. Anybody that knows me knows I'm not an advocate. I suck at it. If you want to know about how bad I suck at being an advocate for somebody and helping get them better care, I can send you a list of names, because everything I've tried never works. That's why I recommend other people to advocate. I think what I do and what Amy does and what Jennifer does and what Kate does and what Leslie does and what Buck does and what Judy does, Scissor Tail, the Real Miss Had, and there's a few others, really are advocates, and they are very good at what they do. I think at best when I get things right, and when Amy gets things right, and when Jennifer gets things right, Kate gets anybody associated with Invisible, when we get things right, it's not about advocating, it's about educating, in my opinion, So, but I think we all understand that once something's in our chart, we're stuck with it.
Pretty much. That's what I'm seeing.
That's why I love my fellow Invisibles that I hate that they deal with it. But if they're dealing with substance use disorder, I love them even harder, because I know it's harder for them to get any kind of care. Right. But that's why so many patients are so guarded about what's in their records. And if you haven't gotten your records in a while, please get them, because it's not necessarily what's in them or not in, it's what's not in them. But sometimes you will see typos. And instead of it saying that you're opioid use dependent, it will say excuse me, it'll say SUD because it's a typo. And if you go to another provider and that typo says S instead of OUD, you're in a world of hurt. So get those records and verify what's in them. Right? At least know what's in them. So if you go to a new provider, you can explain, hey, I don't agree with this. Right?
Right.
Because once it's in that chart, man, and I understand why doctors need to give a diagnosis as well, because it's a billing code for some, and it's an explanation of why additional tests need to be done. I get it, but be protective of yourself, right? We got to be, y'all. You guys know as Invisibles how hard it is just to get through today, and so protect yourselves. See, gentleman said 10 to 20% of diagnoses are wrong according to statistics. Yeah, I can believe it. Kimberly, when you have the test evidence to show it, if you're not seen as a hypochondriac, etc. That's it. That's another big part of it. I got a message from a lady. She was a comment on one of my videos about how she talked about how she got normal test results, but they showed the damage in her back, and she said they were actually horrendous than what she was expecting. And she went through the whole thing about how the relief of having that terrible test result, how it gave her relief, because just like Kimberly said, it shows on the film hard evidence, right? And that record is going to be vital for this person who left that comment going forward. But at the same time, it's like, oh my God, why am I so happy that my back is so messed up? All right. So just kind of a thought, a diagnosis should focus on care, not narrow it. And what I mean is it shouldn't necessarily always end the investigation. What you thought was the beginning of getting answers does not need to turn into a stopping point. Eventually, it may be that you have fibro, because a lot of fibro doesn't really show up on these scans, right? But you have all these symptoms, or you may have POTS, which is hard to document, but you have all the whole checklist, right? If this is new and you feel something else is going on, you need to be on your doctor. You need to have that relationship with them to convince them that you don't think that's all there is, that there's more, and run these series of tests. Besides an EMG, because those really hurt, to find out if there's something else that could be, they can put the diagnosis on. We need to kind of get stuck, prevent ourselves from being stuck in that convenient box of a diagnosis, because sometimes it's only 2 or 3 things that get us put in that box. And when we're in that box, it can end the search. We need to continue to ask questions and continue to explore what's happening, right? Just my opinion. Take a step back, ask questions again. What doesn't fit into this diagnosis? What's going on inside your body that doesn't fit that convenient diagnosis? Maybe simply a thing of saying this symptom doesn't quite fit fibro or POTS or whatever. Honestly ask them, what are we missing? What could we be missing? What other things could be going on inside my body besides fibro that could be causing this? Can we go in that direction and just see? Exploratory, right? Kimberly also brought up a good point about records. If you're trying to get SSI and without these records of being shown what could be causing your problems, it can make it very difficult. So if you can get records that show these things, it can be vital. That's how, without a record in my SSI case, I'd have never won it. There was one record by, mine started with a workers' comp claim. And if their doctor that they forced me to go see hadn't have put something in their notes, I would have never won my SSI claim. So those records can be vital. I want to go back to the definition I used at the beginning that Dr. Leak talked about, that syndromal. Pain is inherently syndromal, and as many patients have already long known before we're even told, a diagnosis at times can mean it's just a cluster of your suffering. Your symptoms all clustered together, all added together can cause a diagnosis. And it doesn't continue the search for the cause sometimes. It's like you're left living inside a label that explains nothing. Does that make sense? Does anybody want to challenge part of that? Please do. I'm up for a challenge tonight. Does anybody question what I was saying? Let me know. I'm not infallible. My opinions can be wrong. My facts could be wrong. Kevin, did I say anything outrageously wrong tonight that you caught me on?
No, sir. In fact, I was sitting here listening, and I was going back to the fact that you put up the label isn't the end, but it's the beginning of I guess, the next story, I think how you put it. So then I guess my question would be, how do you start, or what is a good, maybe one word or one phrase to start the search for the story or for the next story, or however you put it?
So if my diagnosis came back, say, I don't know, fibro, and because my test didn't show anything, I think one of the things I would first accept the diagnosis, because I can go home and I can show my family members, my friends, hey, look, this is official. Get off my back.
Right.
Almost said something else, right? But to the doctor, I would say, okay, can we go a little further in this leg pain, or can we go a little further, with what's going on in my hands and my wrist? Because the reading I've been doing, this type of leg pain could also be saying this, and see how your doctor reacts. Again, I think it goes back to having that relationship with your doctor. I think with my current doctor, if it came back with a certain diagnosis, if I was like, I don't know about that, because I also have XYZ. And this diagnosis doesn't talk about anything with XYZ. Can we go investigate XYZ to see if that could be causing everything else that's wrong with me?
Mm-hmm.
Right. I think that's how I would address it. I would maybe say something, okay, I understand. I understand why. Well, I understand this, but something doesn't seem right. It seems this part of me seems more severe. Can we at least check on this? Or you could go the route of, all right, well, if I have fibro, what's the plan going forward? Because what I'm doing now really isn't helping me any. What can we do? What can we try? Or if it's some other pain related, just ask them, hey, would physical therapy help this? Would dry needling help this? I hear people who are chronic pain patients that deal with nerve pain, that ketamine really kind of helps them. What are your thoughts on that? Does any of that answer your question?
It does. It does. I like how you threw out the suggestions of physical therapy and dry needling. I do wonder if asking for anything outside of that could be considered either opioid or enhanced drug related pulls up red flags. I'm not even sure. And this is why I was kind of asking that question, like, how do you get to I like how you put, hey, so what's next? What do we do about this? And, well, what are my options? Can I do this, and this? Because the last thing I'd want to do is like, trigger the needle on, oh, here we go again. We got another guy looking for a pill mill.
Yeah. Yeah. I think you're going to, no matter what kind of doctor they are, you're going to have better luck getting some kind of therapy that does not include an opioid right off the bat. I'm just going to put it out there. I think even with unicorns, if you bring in outside thoughts and suggestions, dry needling, acupuncture, chiropractor, whatever, as a first or as a new type of a treatment method, if possible, right? Because everybody's different. I think I personally would go that route instead of saying, well, this current plan that you have me on, I don't know, 7.5 Percocets are just not working. I think I need to go to 15s.
Right.
I think that would be a harder, pardon the pun, a harder pill to swallow for a doctor than them saying, well, let's try ketamine. You want to try it? I don't think it's going to help you, but we can try it. Right. And then you try these different other alternative therapies. And then you come back and say, look, I've been trying XYZ. I've been seeing a therapist. I've been doing this. This pain, though, is just, it is causing me to not be able to play with my grandkids. It's keeping me away from getting on the floor. It's keeping me away from gardening. And you know how much that means to me.
Right. Bringing it back.
Can we
to
talk
the
about an
activities.
increase?
Yeah.
Bring it back to the activity. It goes back to another big thing I try to get across to people is we have to be active in our own care plan. So if we offer solutions that aren't always pain med related, I think that shows that we are interested in getting better and having that better quality of life that's not attached to a pain medicine if possible. And I think that's a better route to go. I think it'd be more successful in the end to getting that more relief through a pain medication than just demanding right away. The only thing that's going to help me get on the floor is this. Well, we haven't tried A, B, C, D, E of other treatments yet, right? I'm not saying that the extra pain meds aren't needed. I am definitely not saying that. I am definitely opioid use dependent at good times in my parts of my life. Without them, I am limited to what I can do. But I think we all need to make sure that we're trying our damnedest to be a part of our plan with our doctors. And it's not always possible. I get it. I totally get it. But if we can be, right, I would recommend that route. It goes back to convincing, or not convincing, but explaining, because there should be no convincing that's needed. Just simply explaining to our care team that we just want a better quality of life. And we're going to stand in that corner on the left leg facing southwest if they tell us to, because it's going to help me. I'm going to try it because I'm that desperate to have a better quality of life. And if I stand in a corner on my left leg for long enough, and then I move to another corner and another corner, and I try these different corners, these different therapies, and if nothing's working, then hey, maybe doc, I've done all this stuff, man. Even if we've done that stuff with other care providers and it's in our records, I think we need to be willing to try things with a new care team to show them that we're curious about getting better. I don't think, all right, this is me on my soapbox, and it's happening because I'm in pain. But I don't think anybody, chronic illness, mental health, or chronic pain, goes to a specialist just to check off and show I'm trying. I think we go because we want a better quality of life. And I think a lot of us get to a certain point in our journey, whether it's with POTS or whether it's with EDS or whether it's with bipolar or depression or chronic pain, that we're sick and tired of just being like that. And we want to be able to do more. And I think that's why we go to these appointments. I think that's why we put ourselves through these tests to show I want to get better because we want to be better. Nobody I know on the planet, unless maybe some weird masochist, voluntarily sign up for an EMG test. Because if you have bad nerves, you are going to know you have bad nerves during that test. No, we do that because we want to do what we have to do to get better. And I know that's hoops. I know that it feels like we're having to jump through hoops to get meds or to get better care, but you're jumping through hoops eventually to hopefully have a better quality of life. Just my opinion. I'm sorry for an opinion tonight, but I'm hurting pretty bad tonight. So,
well, you're doing good.
Anybody have questions about what I said tonight? Anybody have questions about anything? Leslie had a good one earlier, and Leslie, I hope gave you a decent answer. That's what I would do in that situation, And as Valerie said, if you guys could just temporarily close out the chat if you have to, and give this a thumbs up. Any kind of comments, any kind of thumbs ups that you can give helps us on YouTube a lot, and that doesn't just help me; it helps the entire network. It helps Dr. Leak. It helps Jose with his, and it helps Katie as well. So they are greatly appreciated. Before we get to victories tonight, and I hope people have some victories. I hope people brought some victories tonight. Does anybody want Amy back on Thursday with me? Would anybody here like to see Amy next Thursday night
I
on
know
this live
personally I'm
with
looking
me?
forward to the invisible experiences you was explaining that last time. It's a whole different vibe, right?
If you want to see Amy on screen with me, berating me, letting me know when I'm wrong, showing off our pet rocks once again, see her with her well-deserved crown on. I need to see some things in the comments so we can prove to Dr. Leak that that it needs to happen. That would really help us out a lot. We have the technology now, obviously, with Zoom's now working because I couldn't be there tonight. Amy would be just like I'm doing right now, but I'll be hopefully in the studio next Thursday, depending on cars. I'd love to have Amy come on, do what we used to do, have a topic for about 10 or 15 minutes, and then get into the comments and find out what you guys want to talk about. I want to get back to that community feeling where it's not just me. I feel like at times I'm preaching, but it feels like I need to do something. And sometimes it's difficult to catch the comments. But Kevin has found a way. I believe that in the studio, I'll be able to see the comments. So we can catch them, and then Amy will be able to catch them as well.
Absolutely.
Look at that. Amy said, "I sound like a crazy person, but I swear I'm nice." She is nice. Amy, what's beautiful. Kimberly says, yes, with all the hugs. Leslie says, bring her. I would say what's good about Kevin, what's cool about it is Amy has conditions that I don't have, like POTS. Amy also deals with migraines, which I do get occasionally. And she's also a chronic pain patient. So we have that in common. But she's like, well, I don't know, Amy, what are you, 25? Right? And you're obviously a lady, and I'm 57, an old crudgy old man. So we cover like two ends of this vast spectrum of invisible, but we meet everybody in the middle because we've all experienced similar stories and similar experiences. So I'd love to have Amy back on. It looks like I have only three people want you back, Amy.
Count me as the fourth.
36. She's 36. She's not 25. I was just trying to be nice, right? Because once you get past a certain age, you're supposed to stop counting how old you are. That's the key there. So yeah, we're going to do it. We can't have Amy back. We'll promote it. I'm sure Amy will talk about it on Tuesday night on her live on TikTok. And we will get the topic for next week out early so you guys know what it is. And it'll be good. The only difference, again, is the comments will be slow. They won't be as fast as they are on TikTok. Other than that, it'll be good to have Amy back. It'll be good to have my partner in crime. Debbie says, bring her in. There we go. We're going to make it happen. And it'll be a different experience for you, Kevin, and for you, Doc, and for you, Evelyn. It's less sadness, I feel. I think a lot of these lives so far, I've been working so hard to let people know they're not alone. They've been kind of downers. So
I don't think you're sad. I think you're just validating, and you sound quite soothing.
Well, 10 years of radio and 5 cartons of cigarettes a day do something for a guy's voice, I guess. So does anybody have any victories that you've had in the last week? Tell me somebody's had a victory. I don't care if it's getting a shower. I don't care what it is that you cut your toenails this past week. That's a victory because I need to live through your victories. We share victories, whether it's you found your unicorn or you had a great appointment or you got to play with your grandkids. We share the victories because we need to celebrate everything because visibles, as Kevin calls them, don't understand how important getting a shower can be. Visibles don't understand how getting to play with your grandkids twice in 1 week can be a major league win. But we sure as hell get it. And also by sharing a victory, what you do is you allow people like me who have had horrendous, god-awful weeks, give us hope that we're going to get some victories soon. You remind us that victories can happen. So if you have a victory, please start typing them in, because if not, I'm going to be even more depressed when I get off this tonight. Amy throws one out, left the house today and took a shower.
Holy crap. Big ups.
Look at you, freaking overachiever. Gotta love that. I'm trying to think of mine in the last 48 hours. I ain't gotten any. So Amy, I'm going to live through you getting out of the house today. I tried to get out of the house tonight, and unfortunately my car, I didn't know cars had that many engine warning lights that could light up on a dashboard at the same time. Um, so I will take Amy leaving the house tonight as a victory for me this week. Buck says, woohoo, I finished my quilt top. Hallelujah. There you go. Kimberly, spine MRI in the books. That is awesome.
Good job. I wonder how long it took to make that quilt top.
It took a while. I think it took a while. So, and I'm going to take Amy doing awesome on the lives on Tuesdays as a win too, y'all, because Amy, when I first asked her to join me on the lives, I'll never forget, first thing out of her mouth was, nobody cares what I have to say. And y'all proved her wrong. You guys really do care what Amy has to say, because Amy has a lot of good ideas and a lot of good thoughts and a lot of understanding. She does more than just paint rocks in her spare time. So, all right. Well, thank you for the victories tonight. Thank you for joining Invisible tonight. Thank you for putting up with the crazy studio like we're in. Debbie says, going to Vegas for a wedding next week. I'll pay later. That's it. That's the attitude. Make the memories, right? Go make the memories. Oftentimes we let our diagnosis get in the way and I can't do that. I can't do that. And then we don't get the memories. For the vast majority of us, our diagnoses are not going to take memories away from us. For some, unfortunately, but for the vast majority, no. We'll go to the grave with our memories, and we need to be able to have them to relive. I'm guessing this is Evelyn. Says, I've been 2 days with reduced stomach pain, and I've had a good anxiety-free day.
Good job.
Hallelujah.
Good job.
Can I have one of those? Can I have one of those anxiety-free days? That is awesome. That is awesome. I'd kill for one right now. But anyway, I am blessed. I have a great team. I have a great care team. And it's not just because he's probably listening. I know where I came from. And I know what I have now. And I am blessed. And if I can help somebody get to that point with a good team, I will do everything on the planet I can do to get you there. Because I really want everybody to be a little bit better. When I tell you guys in all my videos, I hope today's a better day, I really, truly mean it. So anyway, on that note, I will see you next Thursday. I believe Dr. Leak will be live tomorrow for his Friday wrap up. Kevin, do you have an approximate time yet that might be happening? Or is that going to happen tomorrow?
I believe 4 o'clock. 4 o'clock.
All right, we'll look for the thumbnail so we can all click on it for a notification tomorrow. I love the Fridays because that's usually when he's the most candid about talking about me. And I always wait with bated breath to see how bad he's going to nail me to the wall for something I've said. So I'm looking forward to that tomorrow. And it's always lighthearted. He played a video. He created a music video a few weeks ago. So we'll see what he has on tap for tomorrow. You guys have a great week. I am getting back to my messages. So if you've texted me, you emailed me, you've messaged me on TikTok or Instagram, I will get back to you. I'm not good at Facebook. So if you've messaged me there, that may sit in the messenger for months. So I would suggest email keithcpp@gmail.com. TikTok or Instagram is your best shot. You guys have a wonderful week. And until next week, y'all, I will talk to you on social media. I hope tomorrow really is a better day. We'll see you guys. Be safe. Peace.
First rule in this world, baby,